Hello and good evening, everyone. I hope I'm audible. If I'm not audible, you can put it in your chat box. Okay. Hello and good evening, everyone. Am I audible? You can put your answers in the chat box. I hope I'm audible. Loud and clear. So good evening, everyone. Welcome to a new session on Edentu. So in Edentu, we are doing a series of sessions now where we'll be discussing the high-yield topics of each subject for your NEET MDS preparations. Okay. So today we are mainly focusing on dental anatomy. So if you are someone who is like planning to start the studying the subject of dental anatomy, or if you had not yet started the dental anatomy subject, then this session is definitely for you. Okay. So in today's session, we'll be mainly discussing four things. Okay, like we will discuss like what is the general weightage of this dental anatomy subject, and like from the previous years, how many questions were asked from dental anatomy subject for the NEET MDS examinations, and like we will look at the previous trend of the dental anatomy subject, and then we will also see the each question. Okay, we will also analyze each previous year question, and we will assign them to a particular topic. And then at the end of this session, you will be able to see like from which topic more questions were asked frequently, or from which topic more questions were asked repeatedly. Okay, so by the end you will be able to see that. And what we are actually trying to do here is like we are actually simplifying your task. Okay, now only like 6 to 7 months are remaining for your NEET exams, so reading all the theory part and all the topics is definitely a Herculean task for you guys. So we are actually making it simpler for you by analyzing the high yield topics from each subject. Okay, so that you can utilize your study time also more efficiently. Okay, you don't have to waste your time like studying all the uh, unimportant topics from these subjects. Okay, so these are the main high yield topics of the dental anatomy. We will come to know about it by the end of this session. Okay, then we will also analyze the questions that are from the image, how many image based questions and how many clinical or application based questions in the new pattern of NEET exam. How many questions were there in the according to the new pattern of this exam also we will analyze in this session today. Okay, so and then I will also tell you some tips and tricks to on how to crack this subject of dental anatomy, or how to tackle this subject of dental anatomy. I will also tell you after analyzing all the questions. Okay, so let's begin, doctors. Dental anatomy, it is a basic science subject and it is a beautiful subject, but and a simple subject also, but it has like lots of numerical data and like lots of factual data also. So this numerous numerical data and the fact-based questions and all those things that can make this dental anatomy is a challenging subject for some students. So the mainly most of the questions usually come from mainly the chronology of the permanent and the deciduous dentition, and also the like the eruption sequence and the shedding sequence and all those things, and mainly like the age estimation and like the dimensions. Okay, dimensions of the teeth are all like important topics of dental anatomy. And like I already said, this lots of numerical data can make you confusing, can make you confusing, and it can be a challenging process for you people. But don't worry, I'll tell you some tips and tricks to like tackle this dental anatomy subject. So let's begin, doctors. So according to the National Board website, you can expect a total of like 7 questions from dental anatomy. So dental anatomy together with dental histology, you can expect a total of like 14 questions. From dental anatomy alone, you can expect a total of like 7 to 8 questions, which constitute about like 3% of the total questions that can be asked for the NEET exams. Now, if you look at the previous years, okay, like we are analyzing from 2017 till 2024. Okay, so like a minimum of like 4 questions were definitely asked from dental anatomy, and a maximum of like 8 questions can definitely be asked from dental anatomy. So somewhere between the range of 4 to 8 the questions can be asked from dental anatomy. If less questions are asked from dental anatomy, then you can expect more questions from dental histology. Okay, and vice versa also. Like if more questions are asked from dental anatomy, then less questions from the dental histology part. Okay, so so totally you will anyway get like 14 to 15 questions from this, both the subjects, dental anatomy and dental histology. Now, let's analyze each topic. Okay, doctor, each question. Okay, so in the left side you have the topics, and on the right side you have the in the left side you have the questions, and on the right side you have the main topics. Okay, so we will look at each question and we will put them under the main topic where it belongs to. Okay, so by the end you will be able to know like from which main topic more questions were asked frequently or repeatedly. Okay, so that you can focus on those topics while studying for your dental anatomy subject. Okay, that's what we are going to do today. So first question, given image shows the tooth section of. Okay, first two questions are like image based questions, and the given image shows the tooth section of which teeth. Okay, ground section picture is given here, and you are asked to identify the tooth. Okay, it belongs to permanent central incisor, so we can put it under the permanent dentition topic here. Then based on the below given dentition diagram, the age of the patient is. Okay, so this is like one of the frequently repeated questions in dental anatomy. There will be definitely an age estimation question in at least from the dental anatomy. Okay, usually we are seeing it repeating like every year, and sometimes like maybe 1 or 2 years they may not ask, but definitely you can expect an age estimation question from the dental anatomy. Either they can give a diagram like this, or sometimes like recently in the NEET MDS 2024 exam and all, they were giving like a OPG X-ray. Okay, they were giving an OPG X-ray, and they are asked, and we are asked to like identify the age of the child. Okay, usually it will be from the most of the times. Okay, not always, but most of the times the age of the patient will be in the mixed dentition period also, so that it will be like it is more tricky to identify the age of the patient in the mixed dentition period, so they will usually ask from the mixed dentition period also, so you must be prepared for that. And the first question, as I had already given you, sometimes they can give a ground section image like this and ask you to identify the tooth, or sometimes they can give a pictorial representation. Okay, they can give a pictorial representation of the tooth and will ask you to identify it. Okay, then sometimes, yeah, mainly those two questions were asked, or sometimes a clinical picture of the tooth can be asked, and ask you to identify the tooth. Okay, they can give like in this picture they have given like all surfaces like the mesial and the labial and lingual and the occlusal surfaces are given. Sometimes they can just give the occlusal surface alone and ask you to identify the teeth also. Okay, now moving on to a third question from NEET MDS 2017. Which two teeth will have only one antagonist? Okay, so mandibular central incisor and maxillary third molar will have only one antagonist. Okay, we will again put this under the permanent dentition topic. So permanent mandibular canine differs from maxillary canine in which of the following aspect? Okay, so the the last question we are putting it under the occlusion topic also, because it is about the antagonist, like the opposing teeth that is present here, so we are putting it under the occlusion topic. And the permanent mandibular canine differs from maxillary canine in having a less prominent cingulum, so we are again putting it under the permanent dentition topic. Now, moving on to the next question. What is the status of lower second molar root development in a 12-year-old female child? Okay, this is kind of a clinical or application-based type of question. So we are putting it under the permanent dentition topic here, and also adding it in the clinical-based or practical-based question here. And which tooth erupts at the age of 11 to 13 years? So all the age estimation questions and the eruption and the shedding and all the calcification questions, we are putting it under this topic here. Calcification, eruption, and shedding. So it belongs to here. Penultimate tooth is. Penultimate means the tooth that is formed before the last erupted tooth. Okay, this like what you can say, the tooth that is formed before the last tooth. Okay, that is called as the penultimate tooth. So the penultimate tooth is usually maxillary second molar, Again, a question from the eruption and shed eruption topic. Elevation on occlusal surface that corresponds to occlusal developmental groove is called as. Okay. So all this belongs to the physiological form of tooth. So all these are the basics of dental anatomy. Okay, like what is a cusp, what is a tubercle, what is a ridge, what is a fossa, what is a pit. All these are like the basics of dental anatomy, and you must be thorough with it. Okay. Only after studying this, if you look at the anatomy of the permanent and deciduous teeth, you will be able to identify it. Okay, so this basics, the cusp, tubercle, ridge, fossa, pit, and all the ridges and all those other things, you must be very thorough regarding it, because then only you will be able to learn about the teeth also, individual teeth also. Okay, that will make the studying about the individual teeth also more easier. Now, next question from 2018. Mandibular second premolar occlusal anatomy can be of any type except V type. Any type can be there. So it is included under the permanent dentition. Cusp of Carabelli is found in maxillary first molar, again permanent dentition. The permanent teeth showing least variability in the eruption time are the mandibular incisors, which belongs to the eruption topic, and haplodont means single conform tooth. Okay, so this belongs to the comparative dental anatomy. Okay, so not only like human dentition we are studying here in dental anatomy, there is a topic of the comparative dental anatomy where we will be analyzing the other animal dentitions also. So in the other animal dentitions, we'll be mainly dealing with this haplodont, like triconodont, tritubercular molars, and all those things will be again seeing. So this is like extremely important, because in the last NEET 2024 paper, you can put it under oral pathology topic also. Like there was a question, like a girl came for scaling, and while examining the oral cavity, her canines and premolars were shaped like a carnivore. Okay, so what kind of teeth is this? And they have given the options like haplodont, cynodont, and the carnodont, and all those options were also given. So such type of practical based or application based questions can also be asked from this dental anatomy topic. So you must be thorough regarding that. Now, the smallest cusp in permanent mandibular first molar is, okay, it is the distal cusp. Okay, either they can ask questions like this directly, questions like, okay, which is the smallest cusp of permanent mandibular first molar, or what they can do is they can give all the cusps, okay, all the mesiobuccal and the distobuccal and the distal and the mesiodistal, all the cusp names they can give it either in the ascending order or descending order, and they ask you to identify the option. Okay, so that is also a possible way of asking this cusp size questions. Okay, and it belongs to a permanent dentition. Then the oblique ridge is formed by, so oblique ridge is formed by the union of mesiopalatal and distopalatal cusp. Again, a permanent dentition, and all the 8 primary anteriors are erupted in children by the age of 14 to 16 months. Okay, we can put it under the eruption topic here. And identify the tooth. Okay, this is another form of image-based questions that can ask in the dental anatomy. You can see they have given a pictorial representation of the tooth and ask you to identify it. Okay, so these are the primary molars from the lingual aspect. Okay, so here we can choose the deciduous dentition. Next is the 2019 questions. The trapezoidal outline with smallest uneven surface occlusally is seen in, it is seen in the proximal surface of the permanent maxillary molar. Again, we are putting it under the permanent dentition period. That again an age estimation question. Okay, age estimation questions are frequently repeated, and this time it is a mixed dentition period also. Okay, so you can see that both the primary teeth and permanent teeth will be there, and you must not get confused while predicting the age of the patient. Okay, I will tell you towards the end like how to tackle these type of questions also. Okay, so predict the age of the patient. Here it is 10 years. Again, let's put it under the eruption topic here. Superior border of the following motion is dictated by, okay, it comes under the occlusion part, which can be included in the right answer is teeth contact, and which can be put under the occlusion topic. The form of facial surface of permanent central incisor is, okay, it is a trapezoidal form, so we can put it under the permanent dentition. Now this, yeah, the correct order of eruption of the permanent teeth in the maxillary arch is, okay, the shedding sequence and the eruption sequence. Okay, eruption sequence of both the primary and the permanent teeth. Okay, and the shedding sequence of the primary teeth. Both are like extremely important topics in dental anatomy. So if you look at the this recent NEET MDS exam also, there was a question on the shedding sequence of the primary teeth. Okay, so shedding sequence in the maxillary arch and the mandibular arch, and also the eruption sequence of both the primary and the permanent teeth in both the arches are extremely important. You must be like thorough with that. Okay, so here it is option A, and we will put it under the eruption topic. The palatogingival groove is seen on there. Okay, so this palatogingival groove we can identify from the image itself. It is the distal of the like the upper lateral incisor. And based on the given image, lots of image-based questions are here in this 2019 question paper. Identify the areas marked 1, 2, and 4. Okay, so here they have marked like some areas 1, 2, and 4, and we are asked to identify it. Again, we can put it under the permanent dentition, and the below occlusal surface belongs to which tooth? Okay, it belongs to the lower right first molar. Okay, you can see the phi cusp here. So this is the mandibular molar, permanent mandibular molar. So we can put it under the permanent dentition here. Okay, so lots of like image-based questions are also expected from dental anatomy. Now identify the age of the patient. Again, an age estimation question, which again belongs to a mixed dentition period. So the evidence of belongs to eruption. The evidence of tooth calcification starts as which week of intrauterine life? Again, eruption 13 to 16 weeks. The tooth erupts into oral cavity when the root is 3/4 form, then only the tooth will erupt into the oral cavity. So again, an eruption question. And which tooth has greatest width lingually than buccally? Okay, this maxillary first molars will have greatest width lingually when compared to buccal area. So that is included under the permanent dentition question. Okay. Now, the ideal width to height ratio of permanent maxillary central incisor crown is, okay, like it is 0.8. So again, belongs to permanent dentition. The mathematical formula of human dentition resemble which of the following curves? Okay, so there is something called as a quaternary curve, which belongs in the occlusal topic. So we'll put it under the occlusion topic. Teeth with smallest mesiodistal diameter is definitely the mandibular central incisor. Again, a permanent dentition question. And the first evidence of primary teeth calcification is at 4th month. Okay, in the intrauterine life, by about the 4th month, you can see the first evidence of primary teeth calcification. So that we will put it under the calcification, eruption, and shedding topic. Now, Y-shaped occlusal pattern is found in mandibular second premolar, belongs to permanent dentition. The last deciduous teeth to erupt is E, the second molars. Okay, we will put it under the deciduous dentition. And then the ridge extending from the cusp tip to central region in maxillary first molar. Okay, it is the triangular ridge. Okay, so sometimes they can ask direct one-liner questions like this, or sometimes what they can do is they can give an image and mark the particular area or highlight the particular area in the image, and they will ask you to identify like what ridge is this, whether it is like a triangular ridge or transverse ridge. Okay, like that they can also ask you to identify. There was a recent question in the NEET MDS 24 exam like this. They have given occlusal surface of the molar, and they had highlighted a part from the cusp tip to the central point region of the first molar, and then they asked you to identify the ridge pattern. Okay, so this is also an important topic. You like I already mentioned, you must be thorough with your basics of dental anatomy for answering such questions. Now, mesial marginal groove is present in, it is present in maxillary first premolar. Again, a permanent dentition question. Now, again, image-based questions. For the marked length of the tooth, what will be the width of the same? Okay, like 80% of the width will be there. So this is a permanent central incisor. So we are putting it another permanent dentition topic. The mesiolingual developmental groove is seen in mandibular first premolar. Again, a permanent dentition, a question from permanent dentition. The certain common characteristics helps to differentiate a tooth from one another. Which of the following tooth does not resemble any tooth in the oral cavity? So the deciduous mandibular first molar does not resemble any tooth in the oral cavity. So we are putting it under the deciduous dentition topic here. Now again an age estimation question that which is a primary dentition. Okay, so identify the age of the patient from the given image given below belongs to 3 years. So we are putting it all the age estimation questions. We are putting it under the eruption topic. Now next is in a 2-digit numbering system, 3 refers to. Okay, so this is another area where you want to turn your focus into. It is the tooth numbering systems. Okay, we have generally the 3 tooth numbering systems are there: the universal, the Zygmunt or the Palmer notation system, and the FDI system. So they can either ask a question like this, or what they can do is they can give an image. They can give an image of the tooth numbering system and will ask you to identify it. Okay, so that can be done, or like they can ask a question like, okay, what is like 3 3, or what is 2 3 from this FDI system, or what is like 1 6 from the FDI system. Okay, I hope it will be more easier for you guys, because most of you are like working professionals or interns, and you will be using it in your daily clinical practice also. So this is usually an easy question in dental anatomy. Now another image based question. The image given below shows which of the following tooth. So the image shows the permanent mandibular left first molar. Again a permanent dentition question. Now another practical based or clinical based question. When restoring a maxillary canine with an Ellis class 1 fracture in a 12-year-old using composite material, what considerations should be taken into account? Okay, so the short mesial cusp bridge should be taken into account. So for a 12-year-old, we can put it under the permanent dentition period, permanent dentition topic. So this is one of the examples of how clinical or application based questions can be asked in dental anatomy. Usually we think that, okay, like these are the basic science subjects, there will be only direct questions. But for the past like 2 to 3 years, there is a changing trend of that, like more clinical based or application based questions were asked from these basic science subjects also. Okay, usually we think that we can get the clinical based questions from the clinical subjects like ortho, endo, and prosto and all like that. But now the trend is again changing. You can expect like more such clinical or application based questions from this basic science subject also. So you should be thorough with your concept, so that like whichever way they ask the questions, you must be able to answer it. Now, next question. On the palatal surface of the maxillary central incisor, there is prominent labial marginal ridge and lingual ridge. Okay, it forms a shovel. Okay, so that can be included under the physiological tooth included under the physiological tooth form. And the most commonly occurring natal teeth is the primary mandibular central incisor. We can include it under the deciduous dentition. Now the interproximal tooth surface loss is compensated by mesial drift. We can put it under the occlusion topic here. And the shedding sequence of the primary maxillary teeth. Okay, shedding sequence. Again, I told you the shedding sequence and eruption sequence are both important. We can put it under the shedding topic here. And next is identify the structure marked in the image given. So this was what I was talking about, the type of the questions they can ask in the dental anatomy. This is the recent NEET MDS 2024 question, where they are like highlighted a portion of the part of the occlusal surface of the teeth and ask you to identify it. Okay, it is a triangular ridge. Okay, be careful while identifying the triangular ridge and the transverse ridge. Okay, because triangular ridge, it extends from the cusp tip till the center of the molar. Okay, transverse ridge means like union of two triangular ridges. Okay, that is called as a transverse ridge. Okay, so here they are mainly focusing on the triangular ridge alone. Okay, then next again, and like age estimation question with the help of an OPG. Okay, you can see that in the OPG, like there are tooth buds erupting, and there are like teeth that has already erupted. So you need to identify the age of the patient, and here it is 6 to 7 years. So we can put it under the eruption topics here. Okay, so that's all we have. Like for the past 2017 till 2024, there were like a total of like 49 questions from the dental anatomy alone. Now, for this, we will see that the most topics, okay, the most questions were asked from this permanent dentition topic, okay. And the next commonly asked the questions are from this calcification, eruption, and shedding, okay. Then we have the physiological form of tooth and periodontium also. So these are the three highly important topics that you should be focusing more on while studying the dental anatomy part. Okay, first is a permanent dentition. Now I will tell you in the next slide like which topics of permanent dentition you should be focusing more on and how to study this also. But these are the mainly three topics. Okay, you have the permanent dentition, the calcification, eruption, and shedding, and the physiological form of tooth and periodontium. Okay. Now, another topic, like when we analyzed, we didn't get much questions from this topic. That is the occlusion. Okay. This occlusion topic is also extremely important. But like in the previous year, there were not much questions regarding the occlusion. But occlusion is again an important topic, and you have some of the overlapping these things with the prosto also, like some application based or clinical based questions can be asked from the occlusion. So the occlusion is also an important topic. So I will suggest you that you should focus on occlusion also. Okay, so if you look at it, the on a whole, there were like 14 image based questions. Okay, lots of image based questions, and clinical based or practical based till now only like two were there, but you can expect more in the coming exams. Okay, so you should be prepared for that. Now next we will see the important topics of this permanent dentition. Okay, what are the important topics that you should study in this permanent dentition? First and foremost, the chronology. Okay, there are two tables of chronology. One is about the deciduous dentition and another one for the permanent dentition. Okay, in that there will be like everything is given, like when the first calcification happens, when is the crown completion occurring, when is the root completion occurring, when is the eruption happening, when is the shedding happening. All those things will be given in those two tables. Okay, those two tables you must be like thorough with those two tables. Okay, then only you can crack this dental anatomy questions. Okay, so from those two tables itself, like we can like crack most of the questions from dental anatomy, like the age estimation questions and the eruption and shedding type of questions, the eruption and the shedding sequence. All those questions can be cracked with the help of those two tables alone. Okay, I will show you those two tables in the next slides. And then what you should focus again is about the differences between the deciduous and the permanent dentition. Okay, like what are the main highlights between the deciduous and the permanent dentition you should be knowing. And then the tooth numbering system, like I had already mentioned, the three tooth numbering system. And they can either give an image based question of the tooth numbering system, or they can ask you like 3 3 refers to which tooth, or 1 6 refers to which tooth, or 2 8 refers to which tooth. You must be able to answer that also. Then each individual tooth characteristics. Okay, that is the main challenging part. Okay, each individual characteristics, like in the dimensions, you should have a rough idea. Okay, the dimensions of every tooth you should have a rough idea. You should have a rough idea like which is the longest tooth and which tooth has the longest root, and which crown has more width mesiodistally. Like that, you should have a rough idea. I will not ask you to like identify like the proper centimeter of each tooth, because such type of questions are usually not asked for the NEET exams. So what you can do is like the have a general idea about the dimensions of the tooth, like which tooth has the longest crown, or which tooth has the longest root, or which tooth has the like the widest buccolingual diameter, like that or not, you can analyze. And one important thing that you should focus while studying this tooth characteristics of each tooth is that usually in textbooks what they have given is like that they will start a topic like permanent central incisor. Then they will describe all the features of permanent central incisor. Then they will go to the permanent lateral incisor and describe all the features of the permanent lateral incisor. So that is what is usually given in the textbooks. But what I will suggest you to do is like compare and study. Okay, so this comparison and studying, it has lots of benefits. Okay, so once you compare and study, you can like look at the differences between the two teeth, and also your like understanding and retention of the subject will be more. Okay, so always compare and study. Like suppose if you are learning about permanent central incisor, then compare it with the lateral incisor also. Or if you are learning about the permanent like first premolar, compare it with the second premolar also, and know the differences between the two and then study. Okay, that will be more effective also, I guess. Okay, so that's about the permanent dentition. And in the calcification, eruption, and shedding, again, chronology charts, very important. I will show you the two charts. You must definitely like memorize it. And then the age estimation question. The age estimation, like I told you before, it is a frequently repeated question. And like most of the age estimation will be from the like the mixed dentition period also. So you must be thorough with that. Eruption sequence, shedding sequence. Like I had already mentioned, the eruption sequence and the shedding sequence of both the maxillary and the mandibular arches also, and for the primary and the permanent teeth also, you should be thorough with that. Then the physiological form of tooth and periodontium, the types of dentition, like the human dentition is mainly dithyodont and like homodont, heterodont, uh, haplodont, triconodont, all those terms are there. Okay, you must be aware of those terms also. And the basic anatomic structures. Basic anatomic structures means the ridges, cusp, fossae, the pits, and all those things. You must be like thorough with those. And if you see the occlusal anatomy of like a molar or like a premolar, you must be able to identify, okay, this is this ridge, okay, this is this pit, this is this fossae, this is this ridge. Okay, you must be able to identify there also. Okay, that is the basics of dental anatomy. So you must be thorough with that. Embrasures and contact points. Okay, there were like a very less number of questions from embrasures and contact points, or like no questions from embrasures and contact points, but they can ask. Okay, they can ask for this INICT exams also. They can ask about this embrasures and contact points are very important, especially from the clinical point of view also. Like if a patient with a fractured crown like this has come, and if we want to restore it, where should the contact point be, like that, all practical type questions can also be asked from this embrasures and contact points. Or sometimes like direct one liners, like how many contact points are there in the central incisor, like that direct one liner questions can also be asked. And next is dimensions and angulations. Like I had already mentioned, I will like it is not possible. It is not practically possible for someone to like know remember all the dimensions. Like it is like the root of the canine is like 17 centimeter, like that. It is not. If you're finding it difficult, then I will not suggest you to remember all the dimensions properly, but have a general idea about which among the in the oral cavity, which tooth has the longest root, which tooth has the shortest root, which tooth has the shortest crown, mesiodistally and buccolingually, like that and all. You should have a general idea about it. Then the shape and the root depressions also. So, like I had already mentioned, like they were while analyzing the questions, you can see that more image-based questions were asked from this dental anatomy. Okay, like in the recent examinations also, there were like a minimum of 2 image-based questions from dental anatomy alone. So 3 types of questions can be asked for this image-based questions. Now, first is this age estimation question. Okay, so in the age estimation questions for the dental anatomy, either they can give a pictorial representation like this, or they can give an OPG X-ray like this. Okay, and then they ask you to identify the age. Okay, always while age estimation, one tip that I can tell you is that always look at the last teeth that erupts into the oral cavity. Okay, the last teeth that erupts into the oral cavity will be like determining the age of the child. Okay, age of the patient. Okay, so look at the last teeth that erupts into the oral cavity. Okay, now the other thing is like the second type of image-based questions that we can see here is that they can give a particular tooth, okay, like the occlusal surface of this tooth here, or like a palatal side of this tooth here, and they can mark a structure, okay, either palatogingival groove or the triangular ridge. They can mark a structure and ask you to identify the structure. Okay, this is another way of asking the image-based question from dental anatomy. And next, they can ask you to identify the tooth itself, not just a particular structure, but the whole tooth. Okay, so they can give the occlusal surface of this teeth and ask you to identify like which tooth this is, or they can give a ground section pictures of all those incisors and I'll ask you to identify which tooth this is. Okay, so for the image based questions, I will always suggest you to follow the a standard textbook. Okay, for the image, for cracking the image based questions, mainly the first thing that you should do is follow a standard textbook. Okay, so for dental anatomy, we will mainly focus on the Wheeler's textbook of dental anatomy. So in Wheeler's textbook, if you look at it, you at the last few pages of the Wheeler's dental anatomy, after the appendix and all those things, you can see that there are so many flashcards in the Wheeler's dental anatomy textbook. Okay, look at these flashcards. Okay, this is like some of the examples of the flashcards that I've seen from this Wheeler's dental anatomy textbook. There was like age estimation pictures. Okay, this is just the I had included just the mixed dentition period here, but there was like the age estimation pictures of like every age. Okay, from every age, like how many teeth, how many primary teeth are there, how many permanent teeth are there, is like clearly given in the Wheeler's textbook. So you must like go through that, and then the all the individual teeth also, all the individual teeth, they had marked like which structure is this, which structure is that, all the occlusal and the mesial and the distal and the buccal and the lingual side, they had properly marked. Okay, like which structure is this or which structure is this, all they have clearly marked in them. Okay, so these flashcards you must definitely go through to crack the dental anatomy questions. Okay, these flashcards are really important. Like take a printout of it, or like take a xerox copy of it and like paste it where you, in your near your study table, so that you can see it daily. Okay, when you see it daily only, it will get retained in your brain. Okay, so I'll suggest that you follow these flashcards very closely. Okay, these flashcards are really important. The all the type of questions like the eruption sequence and the age estimation questions, mainly the age estimation questions, can be cracked with just the help of these flashcards. And also the important structures on the tooth, and also the important anatomical landmarks in the tooth. Okay, that all can be tracked with the help of these flashcards alone. Now, these are the two tables that I was talking about. The one is the chronology of the deciduous teeth, and the other one is the chronology of the permanent teeth. Okay, these two tables are extremely important. Again, I will suggest you to take a printout of it, or like take a Xerox copy, or like create, or like if you want to draw from, if you want to learn from your own handwriting, you can like draw the table and paste it on your study table. Okay, and see it daily. Okay, and look at it frequently. Okay, so that this both these tables are like etched into your brain. Okay, this is both these tables are extremely important. It has all the things that you need for answering the dental anatomy questions. The first one is the evidence of calcification, crown completion, eruption, and the root completion, and the shedding back ears are all very important. So both these tables are extremely important. Now, like I had already suggested, like don't study individual teeth like okay, these characters will be found in the mesial surface, or these characters will be found in the distal surface, like this. Okay, always compare and learn. Okay, this is one example of this, comparing the two teeth and then learning. Okay, so differences between the, here they had mainly compared the differences between the mandibular molars. So while studying the mandibular first molar itself, compare it with the mandibular second molar. Okay, and then see the differences between the two and then study. Okay, so in this way you will be able to cover like a vast portion of the topic in a smaller time, and since you are comparing and studying, your retention will also be more. Okay, so I will suggest you to compare and study. Okay, so like you can make your own comparison tables, or you can see it from the textbooks also. Okay, so this is one method of comparing and studying. And this is just the mandibular first molars. You can compare it with the maxillary teeth also, like the maxillary first molar and the mandibular first molars. Like that, you can make the comparison tables and then learn. Okay. And one thing that needs to be done is like revise it frequently. Okay. Revision only helps you like retaining the information more easily. Okay. So revise it frequently, look at it frequently, and do that frequently. Okay. Then only you will have better retention in your brain. Okay. Now, another thing that I will suggest you, okay, like the study pattern will be different for different people. So that's why I'm suggesting all these techniques. So another thing that I will suggest you is the mind maps. Okay, these are the mind maps. So like reading all the lines for the all the teeth are like not like it's not a practical solution. So what we can do is we can make mind maps like this. Okay, so in the mind maps it will be a picture and it will be easy for like revision also. So in the mind maps you can see that the 4 or 5 surfaces can be divided. So this, if it is the maxillary first molar, from the maxillary first molar, you can do a division of 5 surfaces. You can buccal aspect, lingual aspect, mesial aspect, distal aspect, and the occlusal aspect. And under each like surface, you can also add like which are the ridges that are found in the surface, which are the pits or the foci or the important features that are present in the surface. You can add it like this in case of a mind map. Okay, these mind maps are really good. They help you in easy revision also. So try making your own mind maps too. Okay, because when you are like writing your mind maps in your own like in your own handwriting, that will be more retentive for you also. So try making mind maps like this also for easily understanding it, easily understanding the characteristics of each tooth, and for revision also. While you are doing the revision also, it will be very easy for you. So that's all about today. I hope like you are very clear about the dental anatomy subject and like how to crack it. If you have any doubts, you can put it in the chat box. Any doubts? Okay. Okay, that's all for today. So all the best for your preparations. Do well. And if you have any doubts or anything regarding this, you can put it under the chat box here. Okay, we will try to answer it. And if you have any difficulty while studying this dental anatomy subject, or like if you're finding it like so, since so many numerical data is there, if you're finding it difficult, you can put it under the chat box under this video. We'll definitely answer that. So all the best for your preparations. Do well. Good night.